right, welcome Tony. Good to meet with you today. Thanks for coming in. Just want to make sure that you're familiar with the environment, do a little bit of housekeeping. Were you shown the toilets on your way in?
Yes.
Excellent. Are you sitting comfortably?
Yes, thank you.
Is the lighting okay?
Perfect, thank you.
Fantastic. Okay, so let's get started. So as I've previously communicated to you, we have three main objectives in this session. One is to identify the steps needed in the chain of survival, including CPR. The second one is to become familiar and learn how to perform CPR on an adult casualty. And I guess that's our main focus because your work environment is adults only. And also to demonstrate how to perform CPR on an adult casualty, and then for you to have a go yourself. Are you comfortable with that? You ready to get started?
Yes, I am.
Excellent. Now, as was shown in our pre-training session questionnaire, you're an absolute beginner, so you've never seen this information before.
No.
Okay, so I want you to tell me, we only have 15 minutes, but I want you to tell me if at any stage you have any questions or if I'm going too quickly.
Okay, will do.
Okay, so I'll just draw your attention here to the CPR chart showing the chain of survival. Doctors A, B, C, D is our acronym, okay? So that's the best way to remember all of the steps. So let's start from the beginning. Does that sound okay to you, Doctors A, B, C, D?
Yeah.
You think that's something that you'll be able to repeat back to me in a little while?
100%.
Excellent, okay. So the first step in our chain of survival is danger. So we're checking for danger, and do you think that is just to ourselves?
And to the patient and to the public.
Absolutely, 100%. It's kind of common sense, but you know, we need to touch on each point. So the second point, which is really important, is the R, to check for response. So to check for response, we do the COWS questions. Now that doesn't mean that we move at the casualty. Can I go through the COWS questions with you?
Yes, please.
Do you mind if I, do I have consent to touch your hand? So if we imagine that you're a casualty and we're checking for response, the COWS questions are C, can you hear me? O, open your eyes. W, what's your name? And then here I go. And the last one, squeeze my hands. Okay? So COWS, can you hear me? Open your eyes. What's your name? Squeeze my hands. No response. Let's move on to the third, S for send for help. Have you ever been in an emergency situation yourself?
No, I haven't.
Okay, thankfully I haven't either, but I am told that we have to be very, very direct when we're sending for help. There's three things that we need to send for: an ambulance, a defibrillator, and a first aid kit. And I would probably give individual people those instructions, because the herd mentality, if you say, oh, somebody call an ambulance, likelihood is it's not going to happen. Okay, so I would probably point to somebody and say, send an ambulance, get the first aid kit, get the defibrillator. Would you feel comfortable doing that?
Yep, I could do
Excellent. So once we've sent for help, we need to have a little look in the airway. So we'll have a little bit of a look on the floor about the actual position and have a practice of it. But the theory is to tilt the head with an adult all the way back and have a little look in the airway. Now, what do you think might be in there to stop that person from breathing properly?
It could be anything. It could be anything they've swallowed, food, anything.
It could be their tongue. If they're unconscious, their tongue could be blocking it. It could be vomit. And if they're unconscious and you're not happy using your own fingers to get that vomit out of their mouth, whose fingers could you use? Theirs, absolutely. So grab their finger and get the vomit out of their mouth. So over to the side, pop the vomit out of their mouth, and then check for breathing. So if the airway is clear, we move on to the B, check for breathing. And the best way to do that is to look for the rise and fall of their chest, or to fit.
Sorry, that's my phone. I'll just get rid of that.
Actually, you know what? Please don't apologise. I think that was my fault because I don't believe that I reminded you to turn off your phone in the housekeeping. So not a problem at all. Let's move on. Can you pop your hand up in front of your face for me and breathe on your hand? What do you feel?
Warmth.
Exactly. So if you put your cheek against the casualties where the breath would come out and you don't feel anything, we can assume they're not breathing and we start CPR. So the main 3 points of CPR are 30 compressions to 2 breaths for 1/3 of the chest depth. So how many compressions are there?
30.
How many rescue breaths do we do?
2.
And what depth of the chest on an adult should we do?
About 1/3.
About 1/3. Excellent. So they're the 3 things that we really need to remember. We're not going to go into infant today because that's not the desired outcome of this training session. So we put our hands together, think about putting one right on top of another, and again I'll demonstrate on the floor, 1/3 of the chest depth, and then of course when we've done the 30 compressions we do the two rescue breaths. That's right. Now defibrillation is the D for the doctor's ABCD. However, we're not going to go into use of the defib today because that will be in a separate training session. We don't have the time to really cover that today. So just checking in to see how we're going so far. I'd really like to just see if that is all making sense so far, not overwhelming. Yeah, okay. So with the doctor's ABCD, are you familiar with a chart like this up on the wall at work?
I believe there is one, yes.
Excellent, excellent. Well, that's just covering off on all our H&S. So would you feel comfortable just going through and repeating for me what the acronym Doctor's ABCD stands for in the chain of survival?
Danger, response, send for help, airway, breathing, CPR and defib.
That's right. And are there any parts of those that you'd like me to go over again?
No, I'm pretty comfortable with that thing.
Okay. So with the cows questions, would you like to just have a practice on me of what the cows questions are? And feel free to squeeze my hands.
Can you hear me? Open your eyes. And
what is
your name?
That's right. And
can you feel me? Close your hands.
S, squeeze my hands. That's it, exactly.
Okay.
And that's why we run over them a couple of times. And you'll find that, I know this is the first time you're doing the CPR training. I've probably done mine every year now for the last 15 years. And it does take a few repetitions to become second nature. So that's why we like to have a little bit of question and answer. Excellent. Okay. So, is there anything you'd like to ask at this point?
No, all good, thank you.
And all of the information has made sense?
Yeah.
Okay, brilliant. Well, at this stage, I'm just going to go and have a little look and show you that at any point, if you wanted to get any repetition after our session, we have this website here, Health Direct, which goes through all of the points that I've just gone through as well. All of the chain of survival. Danger, response, send for help, airway, breathing, CPR and defib, how to carry out CPR and how to give mouth to mouth. So I did just want to touch on that a little bit before we get on the floor and do some actual demonstration. So make sure the person's airway is open by tilting their head and lifting their chin. This is called a pistol grip, probably because it looks like a pistol, okay? Make sure that you're pinching the soft part of their nose with your index finger and thumb. So I speak like that so you remember to do that. And open your mouth with your thumb and fingers. Make sure with an adult casualty that we just do quite a decent sized breath, okay? Excuse me. So again, that's 30 compressions followed by 2 breaths, known as 30 to 2. And when do you think we should stop CPR?
When the emergency services get there,
Yes.
or when they wake up.
Yes, that's 2 of the scenarios. When else do you think?
When someone else comes to take over.
Absolutely, we can take, CPR is exhausting, so we can absolutely take turns. Or when a healthcare professional arrives and basically says that there's no point continuing because they pronounce end of life and that the person is deceased. We hope that that's not the outcome in every case. The other thing that you can do is, I'd just like to point you to this video by Raw Life Saving, and that is a 3-minute video. So I'm actually not going to play that to you now because I think we've used a lot of the time that I've been allotted with you today to speak about it ourselves. But at any point, you can go back to this video, and I'll provide that in the notes post this session, and just watch that a couple of times. What I am going to do though is just go to the part in the video where you can actually see CPR being performed, because that's what we're going to do right now. Can you see that okay?
Mm-hmm.
Other hand on top. Lock your fingers and lean over so your arms are straight. Push the chest down by 1/3, about 4 to 5 centimetres. Now do 30 compressions in time with the flashing indicator on your screen. Count out each compression until you reach 30. We'll wait while you do that.
Okay, so it's our turn. I know that I have to get you back to work in about 5 minutes' time. I hope you don't feel that we're rushing through. I'm just
No,
trying to
this
give you
is
as
all
much
good.
information as we can in this session. Okay, just double checking before we get on the floor. I was given the information that you had no physical barrier to being able to get down on the floor. Is that
Right, all
correct?
good, all good.
Excellent, let's go. Okay, so if you'd like to kneel down, I've made this area comfortable for you. This is a mannequin wipe, which I'd like you just to open and wipe over the mouth of the mannequin. Just for hygiene reasons.
Yep.
Excellent. And then if you can place your mask over the mannequin with the soft area over their face, over their mouth, sorry, that's it. Excellent. All right, so as the video, if you can put your hands together like this, lean over the mannequin and really make sure that you're on top. So you're getting the strength from your whole body to give your 30 compressions. Once you've done 30, I'd like you to tilt the head back with pistol grip and holding the forehead and give a, I'm going to use my mask to demonstrate, and give a big, pinch the nose and give a big wait, and then back to 30 compressions. Do you feel comfortable and confident to do that for me?
Yeah, no trouble.
Now, in terms of speed, do you know the song Staying Alive?
Yeah,
Or the Macarena?
yeah,
Or even Baby Shark?
yeah.
I'm covering all the age groups here. Make sure that that's in that kind of timing, okay? So you might want to sing in your head, Baby Shark, do. I'll stop singing, okay? I'll make everybody uncomfortable. All right, pop your hands together. That's it. I'm going to count 30 for you and then 2 rescue breaths. This is what I need to see before we can progress today. Okay, whenever you're ready. 6, 7, 8. That's fantastic timing. That's it. 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Remember to tilt the head, hand on the forehead, and breathe. Head to the side. Excellent. And another round of CPR. 10. That's really good. More tiring than we think. 20, 21. 29, 30. Pistol grip on the chin. Big breath and then pop your ear to the mouth. Pop your ear to the mouth now. That's it. Excellent. And then another one. And another one. Okay, fantastic. I'm really happy with that. Is there anything you wanted to ask me while we're down here on the ground?
No, that's great. Thank you very much.
Excellent. Okay, well, come and take a seat and we'll wrap up. That wasn't painful, was it?
No, all good.
Fantastic. Oops, don't tread on him. We'll have to ask him the cows questions again. Okay, so anything you wanted to ask about that?
No, that's fantastic.
No.
Thank you very much.
Have you found the one-on-one quite effective?
Yeah.
I think
it's
it's, yeah, you don't have to wait and watch everybody else go
No,
through the
that's right,
practical.
much
We
better
can
than-
get you back to work
Being a crowd of people.
nice and quickly, exactly. So can I just ask before we go that you, if you feel that you have followed or achieved the objectives, which is, do you feel you could identify the steps, doctors A, B, C, D in the chain of survival?
Yes, I can do that.
Do you feel confident with the theory of CPR and know where to find the resources online following our session?
100%.
Okay.
Yeah.
And do you feel confident to demonstrate how to perform CPR in an adult casualty?
Yeah, I reckon I'll be good.
Great. Okay, well, I'm going to provide you with a feedback form if you could get that back to me at your convenience.
Yeah.
And if you have any other questions after the session, you have my email, you have my contact details. So please feel free to reach out. and I hope that you've enjoyed today's session.
Lovely. Thank you very much.
Thank you.
Bye now.
Bye bye.